Hello guys, in this video we'll see about the basics in fracture and healing. Okay, we'll start with fracture. What is the medical definition for the term fracture? Is a break or breach in the continuity of the cortex. If it is a bone, it is a cortex which we see in the last video, periosteum. If any break or breach in the cortex or anything inside the cortex is called fracture. Now we will see about the different types of fracture. Fracture primarily divided into two types. Which may be due to trauma, which is a traumatic fracture, and insignificant trauma, which is other than the trauma. First we will see about insignificant trauma. Insignificant trauma is a fracture which occurred not due to trauma. There are two types of insignificant trauma. The first type is pathological fracture, and the another type is stress fracture. The pathological fracture is nothing but there is normal stress, but the bone is fault. So abnormal biology in bone or abnormal bone. So in the pathological fracture, the bone is abnormal but the stress is normal. The straight opposite to the stress factor, in which the bone is normal and the fracture is due to increased stress. For example, if a military person or a dancer or an athlete got fracture due to over stress during its training, that will come under stress fracture. If you take pathological fracture for an example, if you take osteoporosis or something else which is due to there is a pathology in the bone which results in the weakness of the bone. So already the patient is having a abnormal weakened pathological bone. So the normal stress due as we are doing in our day-to-day activity also, which may lead to the fracture. So that is called pathological fracture, and the other type is called stress fracture. We'll come to the traumatic fracture. The traumatic fracture can be divided in two factors. One is which is the nature of the fracture. With the nature of the fracture, we can divide into two types: open fracture and closed fracture. With the other factor, we can divide it into again two types: direct trauma and indirect trauma. If the fracture is due to the trauma which occurs in the particular bone and the bone which got trauma is fractured, then it is called a direct trauma. Indirect trauma, the person underwent trauma, but the bone fractured is not the actual bone which underwent trauma, but the bone other than the bone which is contacted with the trauma. That is called indirect trauma. In the other factor, we have two types: open fracture and closed fracture. What is the difference between open and closed fracture? If you have fracture and the fracture comes with the contact of blood, and hematoma occurs in a fracture, or the fracture with the contact of blood, is called open fracture. The closed fracture is nothing but there is no blood loss or no blood hemorrhage, then it is called a closed fracture. We'll see everything detailedly in the later. First we'll go with direct and indirect trauma definition. The direct trauma, further the fractures which comes under direct trauma are transverse fracture and communicated fracture. If you take a bone the bone will be here, and there will be a connecting soft tissues will be here. If and direct trauma occurs in a bone here, and which leads to the damage of this bone with a minimal force, that is called a transverse fracture. While the more force hit on the bone and results in the fracture of the bone and also the damage of the surrounding soft tissue, then it is called comminuted fracture. Then we will go into the indirect trauma. In indirect trauma, we can list few types of fractures such as oblique fracture, spiral fracture, butterfly fracture, avulsion fracture. Okay, we'll discuss about all these fractures now. What is oblique fracture? Oblique fracture is a damage to the bone which is also a complete fracture in a particular angle, the fracture in a particular angle, but what's the difference between transverse fracture from oblique fracture is the hit to the bone is not here, it is somewhere else, which leads to the line of fracture in the bone here, that is called oblique fracture. Second, before we are going to spiral fracture, we will go into the butterfly fracture. What is butterfly fracture? Butterfly fracture is nothing but the same oblique fracture line in which two lines over exceed with one another, which is a two oblique fracture occurs, which leads to the triangular or wedge shaped fracture, which they demonstrate as butterfly fracture. Then we will come into spiral fracture. Spiral fracture is a fracture which occurs in the spiral angle, which is due to the extreme or over twisting, then the over to the physiology of our bone. The more stretching to the bone is called which results in the fracture called spiral fracture. Okay, finally, what is avulsion fracture? Avulsion fracture is a fracture at any part of the body where the tendons or ligaments are attached to the bone. Once again, avulsion fracture is a fracture which occurs in any part of the bone where the bone is attached to a ligament or tendon. But the more common site for this avulsion fractures are patella and olecranon. It's a more common site, but anywhere it can happen. Okay, so traumatic fracture, open and closed fracture, direct trauma, indirect trauma, transverse fracture, comminuted fracture, and indirect trauma, oblique fracture, spiral fracture, butterfly fracture, avulsion fracture. Let's move on to the insignificant trauma. As I said before, in insignificant trauma, we are going to see about pathological fracture and stress fracture. First, we'll see completely about pathological fracture. The pathological fracture that we are having may be in subtypes of two types, which may be localized or generalized. The cause for the localized trauma may be infection or ischemia or cyst formation or lesion or tumor which occurs in the single part of the single bone. For example, if a cyst forms in the femur, that is called pathological fractures, which is localized, while if we take in the generalized fracture, the pathology is all the bone, not only the particular bone. For example, if you take the most common cause of generalized fracture is osteoporosis, which results in the weakness of soft bone of all the bones in the body, which can lead to the fracture in all parts of the body. That is called generalized pathological fracture. So the clinical feature for this generalized fracture is, the main clinical feature we can see here is pain, the extreme pain. If a patient comes to you and say like, I'm feeling very weak in a particular part of the bone, for example in the ankle, which we can say is a generalized pathological fracture. If not, the patient comes to you and say like every joint or every part of the bone is having pain, then we can consider the generalized pathological fracture. So this pain resembles like there is a pathology is going on which may leads to the fracture of the particular bone, though we are having the normal stress. So the pain here, the clinical feature explains this only. Okay. Now as a doctor we have to see when we have to give the treatment. So we will use a criteria called Mirel's criteria for categorizing when we have to treat the patient for such a pathological fracture. Mirel's criteria. This Mirel criteria, which will be done by us by seeing the X-ray of the patient where he is staying. So the Mirel criteria we will see under 4 categories. Number 1, the location of the pain, the site of the pain. The second, the moderate of the pain, which is high or low or mild, moderate, and lesion and size. In every category, the minimum mark we will give is 1 and the maximum mark we will give is 3. So for example, site. If the patient is having this pathological pain in the upper limb, the score we are giving is 1. While the patient comes to you having pain in the lower limb, is we will give the points of 2. While the patient having the lower limb pain with the pain in the trochanter, which is if it is a femur, the femur we will having the greater trochanter and the lesser trochanter. If the patient comes to you with the pain in the trochanter, then we will give the score of 3. So upper limb, lower limb plus trochanter. So with the pain modality, the patient comes to you with mild pain 1 point, moderate pain 2 score, while the person comes with you in which the pain affects the functionality of the person, then we will give the score of 3, unfunctional. Then we will see the lesion. As I said before in the last lecture, the lesion can be 2 types in the bone. The one is thickening of the bone, which is the thickening of the bone which is due to the overaction of the osteoblast. Then the second is the thinning of the bone, which is due to the osteoclast overaction. So in the X-ray, if we see that the pathology the person is having is due to the thickening of the bone, then with the overactivity of osteoblast, we will give the score of 1. If the person is due to the overactivity of osteoclast, we will give the score of 3. While we can find the both activities going on in the same bone, then we can give 2. Then finally size. For example, as I said, it is a thickening of the bone. If the thickening of the bone diameter is more than 1/3 of the diameter of the bone, then it is 1 score. Which is less than 1/3 of the bone, we will give the score of 1. If the increase or decrease in the thickness of the bone is 1/3 to 2/3 of the bone, then 2 score. While if it is more than 2/3, then we will give the score of 3. So why we are saying this? After calculating everything, if the total Mirel's criteria score is more than 8, then as a doctor we should see the prophylactic action, what we can do to prevent the fracture of the bone. The second fracture of the insignificant trauma is stress fracture. It's the final insignificant trauma fracture. As I said before, it is the normal bone, but due to the increased force applied, the person is having the normal bone, but due to the increased force applied, there is a fracture occurs, that is called stress fracture. As I said, it's also called military fracture, because the person, everyone knows that the training in the military will be too high with the more stress, which results in the fracture. That is called the military fracture. So the main area which is affected is in the stress fracture is metatarsals. Metatarsals is the main bone which is affected, which is especially the second metatarsal. The second most affected area is third metatarsal. Okay, what is the treatment here in the stress fracture? The treatment here is the stress fracture is rest. Okay, before going into the treatment, we'll see how to diagnose it. The main investigation of choice for our diagnosis is, the main investigation we can do for the stress fracture is MRI, which is a golden standard for here. And we go for treatment. What is the treatment here is just rest and immobilization. These are all the things we have to do for the stress fracture treatment. So we finished with the insignificant trauma, and we'll go for the open fracture and the closed fracture. The closed fracture, there is no need to study anything. It's everything about the definition, that normal fracture in which the hematoma doesn't contact with the bone. Then we'll go with the open fracture. Open fracture, it's a direct fracture. And then the open fracture, as I said before, there is an hematoma contact with the outside. The two main risks with the open fracture is, number one, infection, number two, contamination. These are all the two important factors which make the open fracture to more highly risk and taking long time for the treatment. Then, as we said, infection, the main organism responsible for here is Staph aureus. The severity of the open fracture is classified with the Gustilo-Anderson classification. Gustilo-Anderson classification. This is the classification. We are using this classification, we are going to see the severity of this fracture. In this classification, the severity is explained as 1, 2, 3A, 3B, 3C. We will see everything from the beginning. If the fracture, which is the open, if the wound we are having is open less than 1 centimeter, then it is less than 1 centimeter, then it is a first category classification. If the open fracture is 1 centimeter to 10 centimeter, then it is second criteria. If the fracture is open more than 10 centimeter plus the periosteum of the bone, which I said in the last lecture, if it is a bone, the outer layer is called a periosteum. If the periosteum is intact here, intact periosteum, then it is categorized in the 3A classification. While the wound is open more than 10 centimeter plus, there is a damage in the periosteum, then it is 3B. For the 3C, if the wound here is involved in the damage of the blood vessel, then it is classified in the 3C. Even the periosteum is intact, but there is a damage in the blood vessel, we will categorize in the 3C. Now, using this, the treatment for the open fracture also depends on the classification of this. If the open fracture, which is classified in the 1 criteria, then the treatment should be same as what the criteria we are doing for the closed fracture. While for the 2 and 3A, that depends upon the contamination or the infection occurs, we can choose between the closed fracture treatment or open fracture treatment. While this 3B and 3C will be done with the same the criteria what we are doing for the open fracture. Okay, before going there, I will say how the open fractures are managed. Management of open fracture. In the management of the open fracture, the first thing we are going to do is an antibiotic coverage. The person first we have to give the antibiotic coverage before treating anything. Then, after giving the antibiotic coverage, the person should be done debridement. The wound should be done with debridement. For the debridement, what we are using here is hydrogen peroxide or normal saline or iodine. Using any one of this, we first will do the debridement. After debridement, if we found that wound is clean and good to go, then we can do the closure. This type of closure is called primary closure. If after applying this saline or iodine everything, then we have found that the person's wound is not clear, or the other criteria of number one criteria, if the person wound is not clear or the wound occurred is more than 6 hours, the treated after 6 hours, then the person should undergo tertiary closure. Okay. After the closure of the wound, then we will come with the fracture management. Here the fracture management we are doing is external fixation technique, which is using the which is using the rod and the bolts. Then rail fixator method, then Iliazo ring fixator, These are all the 3 techniques we are using for the fracture management here. Okay, if the fracture occurred is unable to manage, then we will go for the choice of amputation. Okay, before going here, I will explain what is amputation. Amputation is a removal of the bone which is not from the joint. Is a removal of the bone not from the joint. But the another word called disarticulation. Disarticulation is a technique called the removal of the bone from the joint. If it is a knee joint and the bone is here, if we are removing from the knee joint, that is called disarticulation. If we are removing the bone after the joint, that is called amputation. Okay, what is the criteria here we are having for amputation? The criteria we are here using is MES score. The full form for here is Managed Extremity Severe Score. If the MES score is here is more than 7, then we will take the decision for amputation or disarticulation. Okay, now we saw everything what we are going to manage. Now we will deal with, after we are doing every management, after we are fixing everything, how the fracture is healing. The fracture healing in our body is mainly of 2 types: primary healing, secondary healing. What's the difference between these both? The main criteria is callus. If the healing process occurs with the formation of callus, then it is called secondary healing. If the fracture heals without forming any callus, then it is a primary healing. Since the callus is forming, as it is a soft tissue, with the healing starts with the callus, then we can see there will be a minor movement which is called micro movement in medical terms. While the fracture is healing, micro movements. But we won't see these micro movements in the primary, which is rigid. Okay, then we will see that in the fracture healing stages, earlier we can see the hematoma. It is a first stage which occurs in the fracture healing. The site where the fracture occurs, first there will be a formation of hematoma here. That is the first stage in the healing. Second, as a hematoma occurs, there will be a inflammation or granulation will start occurring here. Granulation. Then this is the thing we can see at the time when the fracture healing starts. Then around at the 3 weeks of time, in the X-ray we can see the formation of callus. After the callus forms, now the consolidation will happen. What is consolidation? As I said in the last lecture, that while the fracture healing first takes place is osteoblast, which involves in the thickening of bone. Finally, only for the remodeling, osteoclast will take place action here, and it will remodel the bone. So the consolidation is the thing, as I said, the action of osteoblast. After this action, then the final remodeling will happen, that is the final stage of bone healing. After this remodeling of osteoclast, our normal bone will happen. Okay, now we finished with the management and how the healing takes place. In case the everything we managed and the healing process starts, but for around 6 months we found that the healing process doesn't, the union of the bone doesn't take place proper healing, then it is called the delayed union. So, okay, after 6 months, then the criteria, that's over 9 months also we found that the bone healing doesn't take place properly. We can see some healing process here, but it doesn't unite properly, then we will consider it under the criteria of non-union. So there is something malfunction is happening there. Okay, in non-union we can see 4 types of non-union. Number 1 is hypertrophy. Hypertrophy is the fact that the blood vessel of the bone is, the blood vessel to the bone is intact, that everything is happening normally, and in the area of the fracture we can see the hypertrophy of the callus and the soft area here, but there is no proper union. So here the problem is not with the biology of our bone, but the main problem here is the stability, the fixation or the immobilization. So while managing we doesn't fix it properly, or the patient has having more mobilization, it may undergo into the hypertrophic non-union. Oligotrophic is same as hypertrophic non-union, but the thickness of this, the thickness of the hypertrophy formed here is little less comparing here. Okay, next type is atrophic non-union. Atrophic non-union is due to the deformity in the biology of our bone. For example, the bone doesn't have proper nutrition due to the fact that no vascular supply or any problem with the muscular supply, which will come under atrophic non-union. For these types of patients, okay, will come into the treatment. Okay, this, if we found the hypertrophic and oligotrophic non-union, as we know that the problem here is due to the fixation and immobilization, we will fix it properly and ask the patient to to be immobilized. In case of atrophic non-union, we will advise we will go for the surgery again for the bone grafting. Okay, what is pseudoarthrosis? In pseudoarthrosis, there will be a normal callus formation. There is a normal callus formation in the area of fracture, but due to the immobilization of the patient, this callus will undergo a cystic degeneration, which looks like the our knee bone with a synovial joint. So this is called, so it is named as pseudoarthrosis. Okay, how we will correct this? First we have to do a surgery and remove the cyst, then there will be a gap here, then we have to do the bone replacement here, then stabilization. So the RX we can simply say as corrective surgery. So the another fact here is the bone unites properly, but in an abnormal anatomical position. For example, if it is a fracture happened here, if the fracture is occurred here, rather the bone is joining here, the bone union may be somewhere like this, which is not the non-union but the malunion of the bone. Okay, what is the RX for this malunion? Simple, osteotomy, removal of the bone and grafting of the bone. If it is a children, we can allow for the normal growth. Thank you for watching, guys. We'll see you in the next topic of orthopedics.